Good afternoon, everybody, and welcome to this webinar organized by the European Public Health Alliance. So during this workshop, we are going to discuss how to gather new income streams and secure funds to ensure the sustainability of projects and actions aiming to support Roma, but also other vulnerable groups such as homeless people, refugees and migrants, people with disabilities, LGBTQI+ persons. This webinar involves major stakeholders such as representatives of the European Commission, European Free Trade Association / Norway Grants, Council of Europe, academia and civil society organizations, including members of the Roma Health Network, which will present essential programs, funds, and grants accessible to civil society in new member states and candidate countries. I'm Rado Zakharieva, Policy Coordinator for Health Inequalities and Roma Health, and I'm also coordinating the Roma Health Network, which is hosted by the European Public Health Alliance, and I'm going to moderate this discussion. Without any further delay, I will give the floor to our first panelist, Francesco Zoia Bolzonello, Program Manager at the European Commission, DG Justice, who will present us the latest developments regarding the European programs and grants aiming to promoting and protecting fundamental rights in EU member states. Francesco, the floor is yours.
And thank you all. Welcome. Thank you for this invitation to this workshop, to this seminar. So I will start immediately because I know time is really tight. I will introduce you and I will speak briefly about the Citizens, Equality, Rights and Values Program. So this is a funding program in the European Commission. I come from DG Justice, as it was mentioned, the Director General of Justice and Consumers, and I'm the program manager of this program. So in the European Commission, for those that, just to give you a brief overview, we have several funding programs through which we support civil society organizations and public authorities in many different areas. One of those is the Citizens, Equality and Rights and Values Program. I will call it SERB or SERB. So it's the SERB program. Of course, you might know and you might be aware about other Erasmus+, ESF plus programs, funding programs. This is a program that is managed in DG Justice, and we're proud to present you, to inform you about this, because we would like to support civil society organizations, particularly also in the Roma field or LGBTI plus communities and so on. It has an overall budget of 1.5 billion over the next 7 years, so it's quite substantial. And this is one of the flagship programs that during the negotiation of this 7 years budget of the European Commission, the European Union, it has increased. We started with around 640 million euros. And during the negotiation, Parliament and Council agreed to boost the budget for more than twice its original amount. What is the objective of this program is to protect and promote the rights and values to sustain and what are these rights and values? These are the EU values that we can find in Article 2 of the treaty, which is non-discriminations and fight against racism and gender equality and freedom and freedom of speech and so on. These are the EU values that we want to uphold here. And we want to support also, it's part of the objective of SERB, civil society organizations. This is a key aspect for us. In this funding program, and I'll show you now the slides, so probably it's more clear because we do target a lot of different areas. Disable. Okay, I'm not able to share the screen, but that's fine. Don't worry. I will simply go through and I will briefly highlight to you that the areas that we cover is non-discrimination, combat racism, rights of the child, gender equality, rights of persons with disabilities, EU citizenship right, European remembrance. So a lot of areas, among which the non-discrimination against Roma people, anti-gypsyism, and the inclusion of Roma people. As I understand, this is a focus of this workshop. The program is divided into 4 different strands. One is the union values, which supports grassroots organizations at the very, very local level. For those that work as I said, in all these different areas, we will provide funding to around, in the next 2 or 3 years, 700 small grassroots organizations via this union values strand. A second strand is equality, rights, and gender equality, where we have called for proposals to support gender equality, to support the rights of the child, to support rights of people with disabilities. And then a third strand is Daphne, it's gender-based violence. So we do support actions that fight gender-based violence and violence against children. And the fourth strand is what is the citizens' engagement and participation strand, where we support projects for European remembrance, for town twinning as a network of towns, which means those projects where there is an engagement of citizens, for instance, in remembering and, of course, the Holocaust remembrance and all the different breaking points in history in the past that are still valid for the EU. I'll go directly to what is relevant is the call for proposals and the work program. So this SERB program came out, and we have a work program of 2 years, which is published, and the presentation will be shared with you afterwards, where you will have all the different links in order to access these call for proposals, and the budget is available. So it's a document which highlights the different funding opportunities for you. I will mention 2 of those, which I think they're most interesting for you. One is the call for proposals to promote equality and to fight against racism, xenophobia, and discrimination. It was a 10 million euros call for proposal. It just closed, but we will have a second one coming out this autumn. Will be published in October, November for 12.5 million. And what we look for projects that fight intolerance, racism, and discrimination, hate speech, and hate crimes, among which anti-gypsyism. This is one of the focus of the calls. We also have other focus such as fighting discrimination against LGBTIQ people and promoting LGBTIQ equality, and preventing and reporting and countering hate speech online. So once again, I invite you to have a look. For 12.5 million euros, we will look for projects in these areas as of this fall, where the call will be open. And then there is also a second call for proposals, which is on union values. It's 50 million euros. It will be published also this October, November. And the aim is to support and to empower civil society organizations active in the promotion of values and rights, and whose activities help us in the enforcement of those rights, including advocacy and watchdog activities, and promote safeguards and raise awareness on the union values at a really grassroots level. So what we will do here is that we will first select around 10, 15 intermediaries for, let's say, around 3 million euros each. And these intermediaries will then sub-grant the funding to small grassroots organizations. So to make it clear, this call for proposal will be launched this fall. We will select 10 to 15 intermediaries, so medium-sized organizations, which then will re-grant all and almost all these 50 million to small grassroots organizations, which are around, we counted 700 organizations across Europe. So I invite you also to have a look at this call, especially not at the first level, probably, where there are these big, not this big, but these medium-sized intermediaries, which will be dealing with around 2 or 3 million euros. But then these intermediaries will publish a call for you in order that we want to support grassroots organizations. I think I'll probably stop here because I see that my time is out. I'm available for questions. And all my presentation, once again, will be shared with you, where you find also the how to apply links in the funding and tender portal, and the text of the call for proposals, which is also published. Sorry, before giving the floor to the next speaker, I think it's also important that you will have a look about the selection and award criteria very briefly. Our projects, they have 3 criteria where we are interested, and we will look the score of our projects on the relevance, quality, and impact. This is what we look in our projects for a total of 100 points. And once again, all this information will be available to you afterwards, but I'll stop here. Thank you.
Thank you once again for this detailed presentation. It was very interesting to know more about the European programs supporting civil society organizations. The European Commission actually has a vital role to play in advancing equality and equity as major European values by strengthening the fundamental rights protection, especially on vulnerable groups who have lower human rights protection. However, this is still challenging in many European countries, and for Roma population in particular, which are among the most affected by the COVID crisis, but also the most marginalized population group across Europe. They have lower opportunities for socioeconomic inclusion, and they face a significant level of discrimination. This is a major issue also that deserves special attention from policymakers at all levels. Now, Marina Chicos, Senior Sector Officer, I'm sorry for this mistake. Marina Chicos, trainee at the and the Financial Mechanism Office, will present us how the Norway Grants can provide support for Roma inclusion in European countries. Marina, the floor is yours.
Thank you so much, Radoš. I will just share my screen. So would like to welcome everyone. My name is Marina Chicos, and as Radoš said, I am the Roma inclusion trainee at the Norway Grants, and I joined to the Financial Mechanism Office in last August. And I will also present this presentation with my colleague Anna Stritvors, who is the sector officer for the Active Citizens Fund. So today in our presentation, we will talk about the Norway Grants and its contribution to the better access to health services for Roma people. Just a little bit about the grants. So the grants is founded by 3 countries, Iceland, Liechtenstein, and Norway. And there are 2 main goals of the grants. The first is to contribute to a more equal Europe, both socially and economically, and the second is to strengthen the relationship between Iceland, Liechtenstein, and Norway, and of course the 15 beneficiary countries in Central and Southern Europe and the Baltics. On this small map, I hope you can see those countries, the beneficiary countries, and also the financial allocations in this financial mechanism, which is from 2014 to 2021. In this financial mechanism, the financial support is 2.8 billion euros for 15 beneficiary countries. Another thing that I would like to mention is that actually how the grant is set up. So first of all, the first stage is in the very beginning of every financial mechanism is that the grants made an agreement with the EU on the total funding and the allocations across the countries. And then the grants make an agreement with each beneficiary countries across the areas. And then we have the program development and of course the program implementations. Yes, just a moment. So just a few words about the grants principles. I think it's very important to mention that all the programs and activities funded by the financial mechanism in this period have to be based on the common values of respect, human dignity, freedom, democracy, equality, and you can also see the other important elements. It also has to follow the principle of good governance and be consistent with sustainable development, and of course have to follow a result and risk management approach as well. We have 5 priority sector areas. In this financial mechanism, I just would like to briefly mention them. So the first priority sector is more about innovation, research, and education. The second priority sector is about environment, energy, and climate change. The third one is about justice and home affairs. And the fourth one, which is more important for us now, which actually also Roma inclusion also falls under, is the social inclusion, youth employment, and poverty reduction. And the fifth priority sector is the culture, civil society, good governance, and fundamental rights. So just a few words about also Roma inclusion and empowerment. I hope that you had a chance to look at the materials that we sent previously, because in the blue book you can read more about Roma inclusion and empowerment and the grants and the grants approach to it. Roma inclusion and empowerment is a horizontal priority area for the grants, and we put special focus on the countries which have a large Roma population, such as Bulgaria, Czech Republic, Greece, Hungary, and so on. There are three overarching principles at the grants. First of all is the empowerment of Roma, because I think it's important to mention, because besides the EU also has a lot of intervention on Roma inclusion. This element is somehow still has to be strengthened. However, at the grants we also try to pay attention to this. The second one is about rendering institutions and policies to be more inclusive. And the third one is to target also the majority population. When it comes to the measures, all the measures have to be in line with the 10 basic common principles of Roma inclusion and the EU Roma strategic framework for equality, inclusion, and participation. And we also put a high emphasis on partnerships between civil society organizations, local authorities, and other stakeholders as well. In the next slide, you will see all the programs and countries where we have Roma special concerns, and actually we have one, and there is another program where we have a dedicated Roma program. One is in Greece, and the second one is hopefully will be in Hungary. But you can see all the other countries where we have 10% financial allocation, which means that from the total amount of the grants that they receive, they have to allocate at least 10% for Roma inclusion and empowerment. And I just highlighted you those where we have had components. In two countries, in Czech Republic and in Romania, we have dedicated health programs, where in the MOU they also specifically mention the improving the situation of Roma as well. And in this slide, you can see a few countries that I just mentioned before, and those elements where we address the special concern of the Roma. For instance, in Romania, in the health program, as I mentioned in the MOU, we have a special mentioning on the health status of Roma population, or in other countries as well. Here, maybe I can mention that Radost shared a few days ago a post about a Bulgarian Roma woman's case who actually died in the hospital after suffering 4 days, in pain, and because of the malpractice of the hospital, the whole hospital and the doctors, she died, unfortunately. Just I would like to mention that in Bulgaria, for instance, we have a scholarship for Roma students, medical students, so that they can, live for their dreams and also to continue their education. And when I saw this post, I was just thinking about what would have been the difference if, for instance, there is a Roma nurse or there is a Roma doctor who actually pays, for instance, special attention to this woman and doesn't neglect her suffering. So I think it's a very important example how the grants, for instance, can make a big difference in these countries. And now I would like to handle the presentation to Anna. And thank you so much for now.
Thank you, Marina. And yeah, thank you very much to the European Public Health Alliance. I think this is a very timely event in the context of the COVID crisis, which has not only hit Roma, but also other vulnerable groups in a terrible way. I would like to speak about the civil society support of the EA and Norway Grants. And this is a key priority for our funding. And actually in the last financial period, the EA and Norway Grants were the most important source of funding for civil society organizations in the beneficiary countries. We hope this will actually change with the new enlarged EU program. So in the current period, the Active Citizenship, the Active Citizen Fund is the civil society program of the EA and Norway Grants. And you see here the two major objectives. One is civil society and active citizenship strengthened, and the other one is vulnerable groups empowered. And in the current financial period, the funding program for civil society has a scope of 220 million euros, so quite a significant support. We work with a re-granting model for these funds. Francesco mentioned the re-granting that is planned in the new EU program. We have been doing this for a while now, working with so-called fund operators in each country. This is always a consortium of civil society organizations that is selected in a tender, and that is independent of government. And what they do is that they organize the calls and the information programs in each country in a national language. And we believe this really helps to identify best the needs of civil society and also to help applicants in accessing this program. You see here the 5 areas of support. That's democracy, active citizenship, good governance, human rights and equal treatment. The third one is social justice and inclusion of vulnerable groups. Number 4 is gender equality and gender-based violence. And then we have environment and climate change. And as cross-cut issues, we have youth participation. And there is another condition that we set, that is that 1/3 of the funding must go to activities supporting democracy and human rights. So that's a major focus that we set. Then I would like to give you some key facts about the Active Citizen Fund. Marina, could you maybe go? Yeah, thank you. First of all, capacity building and financial sustainability is a major area of support for us. So 15% of the funding goes to capacity building. That can be for organizations to develop their fundraising skills, work with volunteers, develop their organizational strategies. So that's the funding part, but we also have a couple of rules that promotes sustainability, financial sustainability of organizations. And especially now during the COVID-19 crisis, we have taken the decision to waive the co-financing for civil society projects. So you probably know in many CSOs, this is a burden to deliver that co-financing. So we have waived this for the moment. And we have also set up a pilot scheme for organizational grants or institutional grants that shall increase the planning possibility for organizations, give them long-term stability and a bit more room for maneuver in their activities. Then secondly, the outreach to CSOs in underserved geographies and target groups, that's something very important to us. And actually in the last financial mechanism, this led to quite a diversity of the funding. So we funded in total 3,000 CSO projects. And that has to do with the fact that we really try to support organizations and projects outside the metropolitan areas, in hard to reach target groups, in rural regions. So that's a major importance. Then the bilateral partnerships, that's something that is really integral to all the EA and Norway Grants programs. So bilateral in this context means cooperation between donor countries, Iceland, Norway, Liechtenstein, and beneficiary countries. So that's maybe important for CSOs to know that there is significant funding available for this. And this is often done in rolling and ongoing calls. So if you have an idea for an initiative together with an organization in Norway or Iceland, for example, that's something where it's relatively easy to access funding. And we have so-called donor contact points in Norway and Iceland that are helping organizations to find partners in those countries. I will not say much about coalitions and cross-sectoral cooperation, just to say also there that this is incentivized in the calls. So if you work together with other CSOs, or you plan a project with a municipality or a company, or even with informal groups, there are good funding availabilities. And then last but not least, the Roma inclusion and empowerment. That's a major priority. In our funding, you have seen the areas of support that I mentioned. Projects are possible in most of those areas, but especially in the area of social inclusion. We have in the current funding period so far financed 81 projects targeting Roma, and another 99 projects addressing Roma among other target groups. And that makes in total a fifth of the current projects. So you see that, yeah, a fifth, it's quite a lot. That is really, it's a major point in our civil society program. And among them, there's also quite a few projects in regards to health equity. Marina already mentioned the scholarship program in Bulgaria. And I would like to add another one from Slovenia by an organization called Nevotrom. And this is one where the initiative is about informing people about healthy lifestyles and about preventing illness, but at the same time also bringing CSOs together to promote equality and to promote anti-discrimination in the health sector. So they are combining the awareness raising with advocacy activities. So I think that's a really nice project. I will leave it here and very much look forward to questions, and thank you very much.
Thank you very much, Marina and Anna. Your contributions are very valuable for this discussion, especially for increasing the capacity of Roma and pro-Roma civil society, but also organizations working with vulnerable groups to access European funds, but also to work with the EAA and Norway Grants and benefit from this project. We see that Roma inclusion, but also social inclusion of the most vulnerable society members is high on the agenda of the EAA and Norway Grants. And this is a strong ally offering support to civil society organizations. I'm pretty sure that there will be many questions for you in the Q&A session. And here I will use the opportunity to remind to our participants that we have two question and answer sessions at the end of each panel. So please use the Q&A box to raise your questions and comments. We will be happy to address them during the short discussion that we have with participants. Without any further delay, I will give the floor to Marta Garcia Fidalgo, advisor for coordination of Roma policy at the European Commission, DG NEAR, who will reflect on the role of the Poznan Declaration for advancing equality, inclusion, and participation in the Western Balkans. And more precisely, she will address the challenges and opportunities for civil society organizations in enlargement countries. Marta, the floor is yours.
Thank you. Thank you very much for inviting me to this meeting. And as you mentioned, I will concentrate on the Roma inclusion area. But allow me, as already discussed with Rada, to start with a little bit of the context. First, to say that the EU strategy 2020-2030 introduce very specific novelties, important novelties for area covered by DG NEAR on Roma inclusion. I will go very quickly on them, but I think it's important that you will understand the scope of the area we are working, and the civil society is welcome to work with us on these areas. First of all, in the past, in the first strategy, the strategy only mentioned the Western Balkan countries and Turkey. The novelty of this strategy is that extended the scope much more to cover all regions. They mention in particular, enlargement, neighborhood, and also all humanitarian policies. I think also it's important to say that there is a clear link between the Roma inclusion policy and the enlargement project. I think for the first time, what I say with the first time is compared to the fifth enlargement, the 1 to the 5th enlargement, there was only a general discussion about Roma in the opening phase. Now Roma inclusion is part of the negotiations on Chapter 23, Judiciary and Fundamental Rights. The new strategy also talk about the alignment, the progressive alignment of the enlargement countries with the new strategy, not only on the objective, but also on the methodology. And I think this is very important. We can be able to monitor under the negotiation chapter 23. Other important novelty is that one of the tools that is successful at EU level on Roma inclusion, who is the recommendations under the semester, are now mirrored in the enlargement process with that established that also these dimensions should be covered by the economic and reform programs. And finally, another important change is the funds, the EU funds under the Roma and the DGNR responsibility that can be used to support Roma inclusion. Is not only IPA, as it was in the past, but also the tool, the DG tool that covered all neighborhood countries, meaning the eastern neighborhood and also the side neighborhood. And I think this is an important increase on possible scope, areas of actions and funds available. If I go very quickly on the Poznan Declaration, and I hope you know what it is. If not, I'm happy to further explain in the question answer time. There is also one objective related to health, and is this concept of ensuring universal health insurance and coverage for Roma by accession. If there is not universal, because there are some countries like Kosovo that in general, Kosovo citizens have not this access, at least you have 95% of the rate equal to the non-Roma population. And I think this Poznan Declaration gives a very unique possibility to get the highest political attention to Roma inclusion subjects, including health, because there are annually a discussion in the EU summits with the Western Balkans, the Berlin summits, and is prepared at ministerial level. So for example, for this year, next week, the 28th of June, it will be a ministerial meeting that will talk of the Western Balkans, that will only talk about Roma integration and what are the steps that need to be given in next year in order to succeed this progressive process. And this will be blessed and adopted by a head of state, not only the Western Balkans, but also the member state part of the Berlin process, the 6th of July. Now, if I go more concretely on the financing tools, I would like also to mention that one principle of, and I can only talk about IPA because the neighborhood funds is a novelty. So I have not yet, we don't have not yet experience in this area. But as regards IPA, there are two types of projects, the regional ones and the bilateral, what we call the country ones. On the bilateral ones, the one that is proposing to the Commission within an agreed policy framework, the project is the country governments. So it's not the Commission that is imposing in which areas. What we say is, okay, this needs to be done within this policy framework, but is a proposal for the country. So you need to call, except with several extensions that I will mention, you need to call and to raise the attention of the Western Balkan countries. If I'm talking about the amount of monies and the IPA tools, we have spent on Roma targeted projects, so specifically on Roma targeted projects, 28 million on regional projects and 130 million on bilateral ones. And I would like also to share with you that this project help us even in cases like the COVID crisis to really be on the ground very quickly. And I would like to give you the Serbia example, who for me is one of the best examples of COVID support in the beginning of the crisis. Through the work of the EU delegation in cooperation with civil society, with government, with other internationals, we were able in 5 days, only in 5 days, to distribute hygiene and food packages for a value of 300,000 euros. And I have to say that in this really critical and very rapid action, the role of the civil society was very important, because they were the ones that were on the ground, and they were the ones that could help us to identify the need and arrive to all the places when the distribution was needed. If I talk now about the regional projects, and there are different areas that are covered, I can comment later if you are interested. We have important regional projects. That means that they cover all the Western Balkan countries, plus Turkey, because this is the group of what we call enlargement countries, the countries that are in the enlargement process. We have a lot of projects. One of them is the Roma CAP, implemented by the Council of Europe, and I see that they will be a speaker on the next panel. But we have also a project that finance a network of civil society in the Western Balkans. And this project has a winner, and there is a public call, there is candidates, and there is a winner, and there is a project that covers 4 years. And the important is that the network does not only have a general representative per Western Balkan country, but also as part of the project content, they need to make sub-delegation to a smallest local civil society. Another important project action on the regional level, and I think this brings to the civil society not only a financial support, but also an empowering support that has been very helpful, is the Roma Award, the Enlargement Roma Award. Since the year 2014, and every 2 years we allocate a Roma Award that has not only a certain number of honor or actions, but also a financial prize. And the themes that we have been following is, we have given awards to Roma NGOs for their work. We have also given awards to Roma youth. In 2019, it was to Roma women, and this year award that will be given in September, most probably during the European Parliament Roma Week, concern employment. The employment meaning these groups, institutions, entrepreneurs that had made an important and successful and sustainable effort to give access of Roma to employment, to really a sustainable employment that we know is one of the doors to cross the poverty circle that some Roma are living in. As regards to the future financing, as you know, the next financial perspective, as said by my colleague from DG Justice, will be covered for us, not only for the DG, but by IPA 3. And I would like to get your attention on a very important IPA 3 element. In the past, as I told you, there were regional and country envelopes. The countries know in advance how much money they will receive. Now, in IPA 3, there will not be anymore country envelopes. What there is thematic priority envelopes. And the importance of that is that in order to get support, is not like in the past fight between ministries or authorities, but it's about quality. The best project will get the financing. So I think there is a clear window of opportunity of the civil society with their know-how and using existing structure or creating new ones to support the governments to prepare successful and solid projects, because there will be not a limit of amount of money. Then allow me with two last points. There is another tool that exists for giving financial support, and in this case is more addressed to the small civil society, is what we call the human rights and democracy support. In this case, there are small amounts with less requirements, and in this case is published annually, published in the EU delegation pages, and also allocated annually for several years. And let's me finish with a reflection about our EU assistant. Especially the EU assistant is the one, the NEAR assistant is the one I know best. I do admit the criteria are very high and very often is overcomplicated to be beneficiary. And I think perhaps the future could be on giving more space to the sub-granting within the projects in general and with the support of the civil society. Thank you very much.
Thank you very much, Marta. Thank you for this interesting presentation and information about grants and projects which are available for civil society organization in the Western Balkans. So now we are starting our Q&A session. The participants can raise their questions in the Q&A box, but also they can join the discussion on IFA social media channels by using the hashtag Roma Health, Health Equity, and Sustainable Fundraising. There is an interesting question actually raised by one of the participants concerning the different call for proposals which are available for low income and non-EU countries. And Marta, I think this question is for you, so it will be good to make now a connection again with your presentation.
Can you please repeat the question, because I didn't understood very well what is the point that was raised? Rada, can you please repeat the question?
I'm sorry, I have some issues with the internet connection. So someone raised in the chat box the issue actually of the difficulties faced by organizations located in low-income countries and non-European countries, including the Western Balkans. How we can support, how actually we can increase the support for such organizations based in the Western Balkans or low-income countries in general.
I hope that my previous explanation can already give you some ideas of the different channels. And I do admit, as said in the concluding remark, that our methodology is overcomplicated, and sometimes there are criteria like the minimum action in the past and an amount of money that are really very difficult for the civil society. We have been discussing this for ages, and very specifically when we were preparing this new financial framework. And I have to be honest with you, I think there are no solution. And let's be honest, the Commission does not have the human resources, the capacity to really implement or launch a small project. For us, whether the project has a budget of 500 million or €5 is the same work. So we cannot absorb this work. What I think is important to say is what I mentioned. First, to create networks, and these networks to be part of presenting yourself with other groups to answer to the calls. And I will say also now on the new IPA 3 thematic approach, it will be also a good idea to present you as regional groups. And that will also give you a stronger voice, I think. If you want to pass message, it's not only about financing, the more common are the message, the better are get. I think also the other element is what I was mentioning, the subgranting. And this we have included in the past and we plan to continue in the future. The third element, and that I can tell you when I visit the countries and our project, is that even if we have an implementing group, Council of Europe, we have UN, the role of the civil society is part of this group. For example, in the Roma group, one of the actions that are bringing is to build capacity at local level. So I think there are ways to get into it, but as regards the big calls, I know, and unfortunately, we don't have solutions to address the existing problems and barriers.
Thank you, Marta. You have mentioned the role of different networks actually for promoting the accessibility of EU funds in EU member states, but also in the Western Balkans. And it's a very good transition to our next question, which is, I will read actually the question: is there a platform to co-construct multi-sectoral large impactful programs that can be submitted for funding, or is there funding available to help civil society to develop such programs? I think that Francesco can reply to this question, addressing, of course, the role of the European Commission and the EU funds, including the SERB program for promoting the partnership and transnational cooperation within civil society. Francesco, do you hear us? Francesco, we don't hear you.
Otherwise, I can step in here and maybe answer that question for the EA and Norway Grants already. So we don't have a dedicated platform for this, but we have quite an extensive capacity building program, and we have calls specific for that. And that includes also the development of projects and working on cooperations with other partners. And we also, in the context of the information program for applicants, we give a lot of opportunities for potential applicants to come together and to discuss proposals together. And there is also, in some countries, we have a two-step procedure where first organizations submit a concept note, but then in the second step, when they prepare a bigger proposal, that's when the fund operators really give them support in developing those proposals. So not funding for developing the proposal, but assistance in improving it and making it really good.
And if I may also intervene on this question, in the new EU strategy for Roma inclusion, one of the general novelties now for member states and the system itself is that they are going to create for the first time a kind of a group, expert groups that will include academia, civil society, experts, NGOs, in order to participate in the dynamic evolution of the policy in these 10 years. And I think these kind of problems perhaps can be raised in this group, and if relevant, some comments and proposal could be done through them. I think this kind of Wasteman group opened new possibilities at the highest and most direct political level to raise problems and find solutions in the 10 years of length of the new strategy.
Francesco is again with us. So Francesco, would you like to take the floor and reply to this question too? Thank you. Francesco, you are muted.
Sorry, if I understood well, what are the opportunities for organizations to get together? This is the point. We do have, it's a tool. Once you apply to the calls in the funding and tender portal, and this applies to the different call for proposals, there's a box which says partner search, and you can look there to all the partners that are registered in the portal and that are looking at the same information as you in the call for proposals. So you can have an idea. However, I also invite you, for instance, to look at those partners that have also in the past succeeded in getting these grants. This is a second option. So the list of those that won an award is published. It's under each call for proposal. There is the list of those who won. Third, we had a couple of weeks ago a SERB week seminar. It was a whole week seminar where we invited all different stakeholders. It was live on the internet to participate. And that was also an occasion. It's civil dialogue, what we call, and we would organize something similar again, where we will invite civil society organizations to take part. And that's also a forum of discussion. We hope next time, actually, we will have it live in person. Another way, it's probably, we have, I don't know, we have European networks, organizations also working in the non-discrimination, fight against racism and so on. That is also an entry point where you can get to know other organizations that work on the same issues as you do. These are, several ideas. But once again, I can also take the opportunity to answer to another question that I saw in the chat that was probably referred to me. It was about the EU funding opportunities that I spoke about, at least for SERB, outside member states. For the moment, these are only for member states. So everything that I spoke are funding opportunities within 4 member states. There is a possibility. The program is open to third countries, but there are negotiations that needs to take place, and then a signature of an agreement of the third country with the European Commission in order to join the program, which will probably happen in the past, in the previous program. So the Rights, Equality, Citizenship program and the Europe for Citizens program, that are the 2 predecessors of the SERB program. We had third countries joining, so I'm sure it will happen. For the moment, it's only member states.
Thank you very much, Francesco. The discussion is getting very interesting. Unfortunately, we need to close the Q&A session and start the second one. The COVID-19 pandemic brought actually a substantial change to the socioeconomic context across Europe. And emerging issues such as cross-border public health threats, but also increased health and social inequalities represent an additional obstacle for closing the gap in health between Roma and the general population. And this is also valid for other vulnerable groups, which have already been mentioned in the beginning of the workshop. This situation requires significant commitment from policymakers at national and local level, which in many cases may also need support. Clémentine Trollon-Bailly, project officer at the Council of Europe, will explain us why it is important to act at the local level and build partnership with local authorities to solve long-standing issues such as health and social inequalities. Clémentine, the floor is yours.
So thank you for organizing this very interesting meeting. I'm Clémentine Trollon-Bailly. I'm a project officer for ROMACT. ROMACT is a joint project of the European Commission and the Council of Europe, and it aims at building the capacity of local authorities to develop and implement plans and projects for Roma inclusion. ROMACT is currently implemented, has been implemented since 2013, and it was implemented in 136 municipalities in Bulgaria and in Romania. So it strives for local solution by local people for local needs, and it helps authorities to improve the life of whole citizens, including the Roma, by jointly assessing the needs and planning actions together. So ROMACT is based on a methodology that is common to the one of ROMACTID that Marta was mentioning before. It's 4 steps, and for ROMACT, it's implemented over a period of about 20 months. So the first step is raising awareness and building capacities for the commitment of the local authorities. The second step is about bringing together local authorities and civil society, or more clearly the Roma Community Action Group that I will mention afterwards. So it's agreeing on what needs to be done and how to improve the living condition of the Roma community. And then it's translating it. It's the third step, translating it into local development solutions, local development action plans, and concrete measures. And the fourth, which is maybe the one that interests you the most, but it's the whole process that is important. And the fourth is about like funding and implementing and monitoring measures and projects. So the first key element of ROMACT methodology is the community action group, which is an informal group which is established with the help of the community facilitator that is a ROMACT that we contract, and this person is expected to become the partner of the municipality and to facilitate the participation of the Roma citizen in the local development process. So he supports the empowerment of the citizen at local level, and also it makes the links with the local administration. Another important element of the methodology is the task force for Roma inclusion, which includes representative of the local authorities, but also other local institutions like school, healthcare institutions, sometimes religious institutions, but it also includes relevant NGOs and the representative of the community action groups. In the work of these two groups are interlinks, and it's the necessary connection for the creation of an inclusive action plan and for measures that are aiming at improving the living conditions and the status of the Roma vulnerable communities. Based on what is assessed from the needs of the Roma communities, and of the local authorities, there are experts, ROMACT experts, that are punctually engaged to provide training and coaching to the representative of the local authorities, and also to other relevant stakeholders, sometimes civil society organizations, if it's needed, to support them in strategic planning, identifying sources of funding, developing projects based on the measures included in the local development strategy or in the joint action plans. To respond to the needs of the local communities. So we also have like capacity building activities. So they are based on the needs expressed at local level. And we have training and coaching sessions, also upon request of the municipalities. And among the concrete topic covered, we have coaching and training on project management, which for the case of Romania, for instance, is something that is certified at the national level. Access to funding, and with specific donors sometimes, for EA Norway Grants or for EU funding. How to develop an inclusive and integrated approach, partnership management as well, public procurement, and quite a number of training based on needs. So it develops. It's not necessarily the same type of training that we offer now that we used to offer. So overall, the program is actually investing more or less 25,000 euro per municipality per year. We have invested, now I'm giving the example of, I will give the example of Romania. We are investing about 25,000 euro per municipality, and we have generated by helping by supporting local authorities mainly to apply for a project. We have generated 123 million euro funding for different type of projects. So very concrete results have been achieved, and you can, if you go through this snapshot of achievements, you will see that the number of action plans that have been prepared by the representative of local administration together with Roma citizens, and all the details that I will not be allowed to give during this short time. So besides supporting the local authorities to absorb the EU funds and identify sources of funding, we also support the facilitators are supporting the implementation of short-term measures that are included in the action plans, and these ones have some health measures. So some of the action implemented are actually the employment of health mediators, information campaign on vaccination, on family planning, medical examination. So this is something that is identified as a need by the Roma communities, and that together with the task force and the community action group is raised to the local authorities and is included in the joint action plan adopted by the local council. To give you an example, since 2020, there was also an agreement with the European Commission to have a small grant schemes that is supporting short-term priorities of the Roma communities in order to encourage local initiatives and cooperation between the local authorities and the civil society, and as well to encourage the joint implementation. So there were 76 small grants that have been awarded for a total number of 60,000 beneficiaries, and I think the total amount was about 300,000 euros. And it included provision of information, hygiene kits and foods, but also basic material assistance during the COVID-19 pandemic. This, and my last point about is about the capacity of Romact, given the information it gets from Romact experts and facilitators, to bring evidence from the ground on a number of issues that they encounter in the field. So we have experts that work on briefing and guidelines to report on the barriers that are encountered on the implementation of certain rules or regulations, also in the implementation of and the application process for some funding. So we have produced about 12 reports and guides on allocation of on issues related to non-discriminatory criteria for allocation of social housing, but also on the protection of children left behind with parents going to work abroad. So this is something that exists only in Romanian, but we have a guide on the organization of an information and awareness raising campaign on the protection of children with parents abroad. So to conclude, Roma actually brings concrete results in the municipalities where there is a political will and commitment from the side of the authorities. And this is something that they do formally. On our website, you can find all their commitment letters. And on the other side, it works if it's implemented as per the methodology, which is in a participatory manner by involving Roma and marginalized communities. And this is the only way that we can make it sustainable, and that we can give a sense of ownership to all these action plans that are developed at local level. Thank you.
Thank you, Clementine. As you mentioned, it's important to ensure a participatory process for designing and implementing policies and making them more effective and sustainable. Now, Petronella Sturt, Head of Department for Development, Investment and Public Procurement in EU project, representing the local authority of MISIL, which is also a beneficiary of the Roma program in Romania, will explain us why we should build partnership with vulnerable groups to address inequalities within the country. Petronella, the floor is yours.
So I would like to start with a very short presentation of the city of Misil. The city is situated in southeast Romania, 100 kilometers far from Bucharest and 35 kilometers far from the two capitals of the regions, Ploiești and Buzău. The in-city surface is 5 square kilometers, and total surface, including surrounded areas, is 19 square kilometers. The city lay down on the border between the Romanian plain and the Dealul Mare hills. According to the census made in 2011, city population is 14,312 inhabitants, and the number of dwellings is 4,624. Official data is giving a ratio of 12% from total population of Roma people. According to the unofficial data, which results from various statistical reports, social program, etc., this percentage of Roma population reaches 30%. 93% of the population is Orthodox and 7% other religions, especially members of Roma community. The town houses 2 high schools, 3 primary schools, and 4 kindergarten. Health system of Misil consists of a hospital, managing also an ambulatory and a tuberculosis dispensary, all treating the people from Misil and surrounding villages, around 60,000 inhabitants. Main economic activities, industry with food processing, ready-made clothes, furniture and defense, buildings, agriculture with vineyards, crops, livestock, and services like trade, banking, and communication. And some pictures from our city. So, as you can see, city of Misil is a very small city, but open and responsive to its citizen needs and desires. By the way, I have to mention that the motto of the municipality is "At your service, citizen," but I have to say that we understood that the best way to work for the community is to work with the community. In this regard, I would like to give you some examples. This year, the municipality has developed the Integrated Urban Development Strategy 2021-2027 with the support of the community, inviting, among others, representatives of vulnerable populations such as Roma community, persons with disabilities, and so on, and representative of NGOs to focus groups organized during the data collection stage and the strategy formulation stage, but also at the final consultation. Now we have a strategic document reflecting the whole community needs in different areas and also funding opportunities identified. Another strategic document developed by the local administration is the local action plan to improve the situation of Roma in Mizil with the support of Roma experts, as Mizil was one of the Romanian beneficiaries of Roma program. The document includes measures in areas as education, health, public services, and so on, with target on Roma population. This plan is now in implementation and projects included in the plan being in different stages. So, City of Mizil has developed and implemented or is implementing some projects addressing equal access of all population, including Roma, of course, to a better life, a healthier life. For example, we built a block of social dwellings with 30 apartments financed by the governmental program for building social houses, according to law number 114 from 1996. The project was finished in 2019 and beginning with 2020, 30 families, part of them Roma, has moved into the new building, living in very good conditions and paying a very low rent. Another project was implemented by the City of Mizil with funds coming from Roma program, Help for Vulnerable Population during pandemic times. In this project, implementing at the beginning of COVID-19 pandemic, 300 persons, especially Roma and old persons, received kits consisting of products for health protection, but also valuable information about the right behavior during pandemic times. Project was implemented in partnership with Social Assistance Direction and the cooperation of Roma volunteers. City of Mizil is implementing two other projects. Extension of water and sewage, financed by the local budget, and modernization of our streets, financed by the National Program for Local Development in areas inhabited especially by the Roma population. Through the implementation of the project extension of water and sewage system, City of Mizil is conforming with European rules regarding the access to water and sewage system for all population, but also is responding to its citizen needs for access to basic utilities for a healthier life. On the other hand, street modernization, a project expected so much, is improving the quality of life for people living in the area. Now, parents won't stop any more children from going to school due to mud formed after rain or melting snow. Now the risk of diseases decreased due to the cleaner environment, less dust, risk of sleeping into the mud, risk of transmitting the diseases by animals and so on. I have to emphasize that all above mentioned projects have received good support of the community due to the communication between community representatives and municipality representatives. City of Mizil has a good experience too in making partnerships for developing projects. For example, for project integrated approach to the difficulties faced by Roma children and young people in Mizil, establishment of the Mizil Socio-Educational Center. A local initiative group was founded by Roma community, but also a partnership with NGO Pestalozzi Foundation and the school with majority of Roma students was agreed. This project was approved, but unfortunately the local council didn't agree to continue the to sign the contract due to some changes into the financial projection for sustainability period. Another project developed by the municipality in similar condition was Together for a Better Life, made in partnership with Roma Cultural Center O de la Mensa, schools and social assistance direction. The application was made on Norway Grants. Project was not financed, but the main gain, I would say, was to work together, the municipality and the representative of the citizen, including Roma people. We found the proper way for communication. Thus, municipality had the opportunity to find out the needs and desires of the community, and for the community to understand that the municipality makes every effort to meet the needs and desires of the community. But
Camilla, can I ask you to conclude because we are running out of time?
Yeah, okay. I would say that the most important strategic partnership for addressing problems of Roma people or other vulnerable categories, not only health inequalities, was with Roma Act team that supported our municipality with knowledge and funds. As a conclusion, I would say that for solving important community problem is necessary that stakeholders to be involved, and the best results can be achieved and when representative partnership are established. Thank you.
Thank you, Petronella. Building partnership through a structured dialogue with civil society organizations representing vulnerable groups, but also the inclusion of vulnerable groups in such a debate is essential for developing policies which can meet the needs of the most vulnerable. Strategic partnership contributes to advancing cross-sectoral and transnational cooperation, especially in the case of health equity, which requires sustained efforts from a wide range of stakeholders. Daniela Miranda, researcher at the Center for Community Research and Action at the University of Sevilla, who has been involved in the design and implementation of a transnational EU-funded project, will share her insights about the key factors for building sustainable and strong partnership. Daniela, the floor is yours.
Thank you, Rados, and thank you for the opportunity to share our experience. My name is Daniela Miranda. I'm going to present some key factors from our Roma Matter project on building successful transnational projects. And my colleague Manolo Garcia, who is the coordinator of this project, will be here to answer questions at the Q&A. So I'll try to go a little quicker than expected. So we are the Center of Community Research and Action at the University of Sevilla, called CESPID, which stands for the Coalition for the Study of Health, Power, and Diversity. And here we just want to highlight that we're a network, a very diverse network. We're university-based researchers, but we work very closely with Roma grassroots organizations, other public authorities, and other universities in Europe. And in 2019, we were granted the Roma Matter project. The Roma Matter project is a transnational project that aimed to tackle gender discrimination by creating a supportive network for girls, for Roma girls, in Romania, Bulgaria, and in 2 contexts in Spain, to help them envision their expectations and their goals for the future and address the issue of early motherhood. And then, as you can see, we finished the project a week ago. As you can see on the screen, we're 10 partners. We have a research and community partner in each context and across different countries with external experts from the Netherlands, the UK, and Hungary. So just briefly, what the Roma Matter project is 100 Roma girls from Bulgaria, Romania, and Spain, including their mothers, teachers, other local actors, including the researchers and communities, supported girls in identifying what their dreams for the future were, and to help and support advocating for the girls to advocate themselves for the resources they needed. I think an important aspect of this project was that we created a setting for girls from these different countries between the ages of 12 and 15 to connect with each other and with other women, to really just share the knowledge that they had developed at the local level, the research that they had done at the local level with each other, and advocate with international actors and national authorities and local authorities as well. And well, we want to tell you a little bit of how we got here. How did we arrive at the Roma Matter proposal? Our research team had a trajectory, which I think is relevant to how we built a very diverse network and a network that was multi-level. We started off participating in a cost action grant, which was the Cost Adapt, which there was researchers and healthcare service providers that were trying to address the challenge of diverse populations and creating healthcare systems that were responsive to these diverse communities. And within one of those actions was there was a Roma specific action, which connected us with other researchers, policymakers, and intergovernmental organizations. For example, the International Organization for Migrations, which granted us, commissioned us to do a national study of how Roma health policies were impacting local communities. And through that, we were able to achieve a pilot study here in Sevilla. We're based in Sevilla, and we worked in building local coalitions and addressing the challenges of participation Roma communities were facing. And through that, we were able to find continued funding and support from the Open Society Foundation, which is where the Roma Matter project really is born from. We were working with Roma men and women, but from this experience, we were listening to what the women and what the girls in the community were saying. So for us, it's important to highlight that through these different networks and existing networks, finding allies in different spaces, not only other researchers, but healthcare service providers, teachers, local leaders, and really listen to the community priorities and to remap the relevant actors based off of the community. And so how did we build the Roma Matter proposal? Well, we reviewed the call for proposal and linked it to the EU priorities at the time were the NRIS, the National Roma Integration Strategies, and the issue of Roma women and girls participation, which continues to be a challenge today. And through that, we looked at what we had as a research group and what we needed to develop the proposal. And the first thing was technical support. We worked with experts who knew how to develop a EU proposal to help us with all the small details that, that were difficult to do only as a small research team. The next is that we looked for partners with our networks and our experiences who were doing similar work or doing things in a similar way with similar values, and really look at what we were missing to reach this mission and this goal to address reproductive justice and gender discrimination with Roma women and girls. So we built diverse partnerships in Bulgaria, Romania, and Spain, university and community partnerships. And it was very important for us that the organizations that we were working with were very grassroots and very rooted in the community, so that we were having real relationships with the girls and women. And also the different representation all over Europe, as I said, Bulgaria and Romania, and in 2 contexts in Spain. And I think that these are just a few lessons learned. We just finished the project. And so these are maybe our most recent reflections of what we think has been successful, because we have created a very strong supportive network at the local level, but also between partners in the different countries. And as soon as we were implementing the project with girls, COVID happened. So I think that the relationship and the communication that we had to create between partners to respond to organizations that were in the community providing food for families, and we were all very flexible and adapted without losing sight of the mission. And that also caused us to have to negotiate conflicting agendas between research partners, organizations, authorities. And I think also one of an important issue to highlight was that we were able to develop different mechanisms for accountability between partners and organizations. and create opportunities at the national and local level for sustainability. And I try to be as quickly as possible, Rados. But if you have any questions, you can see, I'll put the website in the chat. Thank you.
Thank you very much for sharing your experience and knowledge built within the Roma Matter project. It's a very good example on how to create transnational partnership and how to ensure the sustainability of such partnership involving grassroots organizations based in different countries, but also working in different sectors. Thank you very much for that. Today, we have also Daniela Filakovska, representing the Department of Health, Psychology and Research Methodology, Faculty of Medicine at Safarik University in Košice, Slovakia. And Daniela will contribute to this discussion by addressing the role of European universities in mitigating the pandemic's impact on the most vulnerable, but also on building resilience of public health systems. Daniela, the floor is yours.
Okay, thank you very much for this invitation and this opportunity to share and discuss this topic. I will try to be very quick. Okay, so I would like to illustrate this topic on an example of a newly launched European research initiative to improve equitable vaccine uptake in underserved communities, funded by Horizon 2020 research program. The RIVER EU is a 5 years project. 14 institutions from 10 European countries, mostly academic, but also non-academic, will work together towards mutual objectives. So RIVER EU will collect evidence on health system determinants of high and low vaccine uptake in 8 specific contexts, including marginalized Roma communities in Slovakia, which will be used to identify and develop interventions to reduce barriers to vaccine uptake in underserved communities and increase trust in the health system. On the basis of the gathered evidence, this insight from enabling factors from Bangladeshi community in UK, Arab Israeli community and Somali community in Finland will be translated to provide useful insight to design interventions addressing health system barriers in 5 target communities. These will be refugees and migrants in Greece, adolescents of Turkish and Moroccan origins in the Netherlands, Ukrainian economic migrants in Poland, and marginalized Roma in Slovakia. RIVER EU will design, implement, and evaluate interventions to improve access to vaccination using a co-creative and collaborative approach. The lessons learned will be collected in a set of evidence-based guidelines and implementation recommendations and disseminated to health policymakers and professionals across Europe to improve the performance of vaccine programs and to reduce vaccine inequalities. And from my point of view, to be successful in applying for grants and building knowledge through transnational projects, the most crucial is building long-term and stable partnerships. Because to build a strong consortium with reliable partners, you need to build partnerships with other universities, of course, but diversity of researchers brings the opportunity to learn from each other and to design the research with sound methodology. To be able to translate gained knowledge into the policy and practice, you need to build partnerships also with policymakers, with healthcare institutions and professionals, with organizations working with or advocating for target communities, and most importantly, with community members. That's why also the RIVER project, we chose to the approach of participatory action research. This means engaging community members and all other relevant stakeholders in each phase of the project. This is how we can move them from the periphery to the center of the production of scientific knowledge, designing the intervention and evaluation. To bring maximum effect, we build partnerships with healthcare professionals, institutions, and societies engaged in both in a topic of vaccination and with target communities. The design of participatory action research stands on 3 pillars: participation, action, and research. So the role of universities here is the research part, of course, because the first thing is identification of problems and needs. The knowledge is right there, and we need to collect those pieces from community members, from healthcare professionals, from public health authorities, policymakers, and others. But our role is also to support participation and action. We will first identify health system barriers for underserved communities from the point of view of all actors involved. At the same time, we will look at countries where similar communities have good vaccination rates, even in the underserved communities. And we want to find out what are the facilitators that make it possible and what are the successful interventions that are implemented there. We will also look at the literature and published studies on barriers and interventions, and all this will be done using scientific methodology, and it is our role as researchers to lead this process and to translate all the outcomes of research into the knowledge based on which we will be able to identify and design successful and acceptable intervention. We as the researchers will not be those who will implement it, of course. That is why we need all those partnerships, but we will be those who will evaluate it. And this is another role where researchers can be very useful. It often happens that the story of a great effort ends by implementation. In recent years, the professional community has agreed that interventions need to be evaluated because it is extremely important to know what works and what does not. What are the benefits, and to inform about it so that the interventions can be replicated and modified. Therefore, we plan to monitor and evaluate the implemented intervention. Only on the basis of such comprehensive examination and after the completion of all these steps, we will issue a report and country-specific recommendations, but also more general recommendations for the European region as a whole. So what is our role as the universities? Our role is to conduct demand-oriented research and try to find overlap between public health goals and actual health needs of communities. Our role is also to produce scientific knowledge for evidence-based policy and practice. And we aim to systematize and translate the knowledge of civic society and lay public into scientific knowledge using sound and rigor methodology. Thank you for your attention.
Thank you very much, Daniela. Vaccine equity, actually, it's a very important issue affecting vulnerable groups in COVID-19. And this required sustained commitment at all levels to ensure equitable access to COVID-19 vaccines for all, including Roma communities and other disadvantaged populations. Now we are running a little bit out of time, and I would like to thank our participants that are available and can stay with us for the second Q&A session. So the first question of this session will be again to Daniela Filakovska. I would like to ask you for your advice on how to build sustainable partnership between academia and representatives of vulnerable groups, civil society organizations, but also vulnerable groups themselves, how to better include them in this process of building knowledge. Thank you.
Yeah, this is really complicated. It took us more than 10 years to build stable partnerships. But basically, maybe it's because Slovakia is such a small country. We know each other very well. We know all the actors in the field. So we approach each other easily. So maybe this is advantage of very small country, that we really know each other. But I would say that don't be afraid to simply approach organization and search for contacts and start the discussion. Don't wait to be contacted.
Okay, thank you. We have also another comment presented by the Slovenian Coalition for Public Health, Environment and Tobacco Control, highlighting the regional divide. Actually, inequalities exist between countries, but also within countries, between population groups. the Slovenian coalition underlined the existence of regional inequalities also in accessing different EU funds and programs provided by the Norway Grants or the Council of Europe. So my question is for Clementina, how we can support or Roma program can support better civil society organizations at national and local level to tackle regional inequalities.
So ROMACT it's really implemented. So I remind it, it's implemented in Romania and in Bulgaria, and it does not provide any funding. It provides expertise and capacities, and this is this expertise and this capacity building activities are organized based on the needs, and they are organized also in an inclusive manner, so that the civil society is supported as well as the local authorities. But as for regional inequalities, this is really based on what will be the need at local level. So this is how they can be supported. There will not be the same needs in one part of Romania to the other part of Romania. I am not sure if I fully answered the question, but I wanted to clarify that the ROMACT is really, it has like it's really implemented in specific places based on and this is what makes it easier for us. It's that it's based on the commitment of local authorities. So there is already a will from the start to have them included at local level.
Thank you very much. Now, for the interest of time, we can take only one question. And this question concerns actually local authorities, and we have Petronella Sturz representing a local authority of Mizil with us. What are the obstacles, Petronella, that local authorities faced in Romania in building and implementing transnational projects?
First of all, the capacity of the local administration, of the municipalities. So I have to say that we are facing big difficulties in, even if we accessed fundings, it's very difficult to implement projects because we have less people that it's necessary. And it's even more complicated to make application. That's why we are contracting consultants and experts to support us. It's one issue. Another issue that a local administration is facing is about the co-financing that is needed for some projects. And even the funds that are necessary for the sustainability period of time that you commit to support after a project is finished. And as I said in my presentation, we had this case. Another difficulty is about the availability of the funding opportunities that is sometimes is interesting, but you cannot access because you need some specific experience. So, like for Norway Grants, I know that it was a requirement for local public authorities that have to have before some projects implemented in the same area that we applied for. That are the main obstacles that I'm thinking right now.
Thank you very much for mentioning the need for ensuring a co-funding for transnational and EU-funded projects. I think it's a very important question, and also in many occasions it can be a barrier for small organizations or those acting at local level to ensure the budget needed for co-funding such projects, and it also can prevent such organizations and such stakeholders to apply for European funds. Yeah. But today we got many examples of programs, grants, and also European funds which are available for civil society organizations at all levels. And we also got many examples such as the Roma program providing capacity building, the Norway Grants providing significant support to national stakeholders, which do not require co-funding. So I'm pretty sure that this information will be very relevant for our participants. And I would like to thank all of you for the questions, but also for taking your time and replying to these questions. Now we are moving to the last part of our discussion, which is the conclusion. So to conclude, I can say that we got very interesting examples of projects, but also new programs, new developments at European level aiming to advance fundamental rights, including equal access to health services. So it is clear that European funds, but also programs and funds provided by international and European organizations can advance cross-sectoral and transnational civil society cooperation, but also bring together national and local authorities, civil society, and vulnerable groups to develop comprehensive policies. And this is an important lesson that we need to learn from the pandemic, but also to apply this principle in a future programs and policies developed at all levels. So I would like now to thank our participants for their questions, for their patience, and for their active participation in the Q&A session. I would like also to thank our panelists for their time, efforts, and participation in this event, for their interesting presentation. I would like also to say that all these presentations will be disseminated together with the video recordings. Our participants will receive them by email, but they will also be available on our website on the events webpage. So I wish to all of you a nice afternoon and look forward to your participation and involvement in our future events. And meanwhile, I will be happy to stay in touch with all of you through IFA social media channels, but also through by email. My email and contact details are also available on IFA website. Thank you very much once again, and have a nice afternoon. Goodbye.